your child shine with creativity, confidence, and a whole lot of fun.
iMac Cochin Kalabhavan is back with Summer Class 2025, a perfect mix of learning and enjoyment.
From cinematic dance, classical dance, vocal music, instrumental music, to art and craft, drawing and painting, and martial arts, we have got something for every young talent.
That's not all. We have lined up fun activities like field trips, movie time, yoga, games, thrilling competitions, and much more to keep the excitement going.
Worried about transport? We've got it covered.
And for the grand finale, every child's performances will be live streamed on BMC Global Live.
And guess what? All this at an affordable fee so that every child gets a chance.
Admissions are open now, and here's the best part. First 50 admissions get the registration fee for free.
So hurry up, call the number shown on the screen now to give your child a summer full of joy, creativity, and new friendships.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. Welcome to BMC Global Live Al Hilal Health World, nothing but lifestyle. And I am Jasila Mujib, your host for today. Today we will be discussing about a subject that has touched every corner of the globe, the COVID-19 pandemic. And to speak authentically about this subject, we have with us Dr. Prithvi Raj from Al Hilal Hospital, Salmabad. She is a general practitioner with an experience of more than 10 years. So doctor, welcome to the show.
Thank you. Thank you for inviting me over here. So, yes.
So, it's a pleasure, doctor. So, doctor, what is COVID-19? How do you describe it?
COVID-19, I'm sure that everyone knows about it already because, yeah, everyone around the world knows about it since 2019. So, it's basically a viral infection, especially termed coronavirus. So, once you get infected with this coronavirus, you will have flu-like symptoms. But in some cases, they might have some severe conditions as well because of the infection, okay?
So, doctor, now you mentioned about the symptoms. Can you explain it in a detailed manner?
It's basically like multi-system, okay, involvement is there. So, you will be having, maybe some people might be having just fever or they might be having cough, okay? But overall, the symptoms are fever, chills, cough, runny nose, sore throat, sometimes congested eyes, body pain, headache, then maybe dizziness or tummy pain, vomiting, loose motions. So yeah, you can have multiple symptoms, but it is not required to have all of these symptoms. The most specific one is loss of taste and loss of smell, but it's not necessary for you to have it as well. So you might have maybe just fever, body pain, or you might have few of the symptoms. Okay.
So how can we differentiate between the symptoms of COVID-19 and the flu or the influenza?
Symptoms are almost the same because these are all viruses, especially RNA virus. So flu, I'm sure that everyone knows it's influenza, okay? And we have vaccines also for that as well. Seasonal flu. And then there is common cold. Common cold is caused by rhinovirus, and COVID is caused by coronavirus. So all these are viruses, and you might have the same symptoms, and you might not have all the symptoms, but yeah, symptoms are almost the same. These are all viral fever. So the most specific symptom for COVID is obviously loss of taste and smell. Okay, and sometimes if your nose is blocked, you might not be able to smell. That is there. But so you can use some nasal drops and see once it is opened. If you try to smell, if the smell is there, that means it might not be COVID. But still, as I said, it's not necessary for you to have loss of taste and smell. Okay, even runny nose itself is a symptom for COVID.
Can you explain about the new variants of COVID?
We have like so many variants. So the first one was COVID-19, and afterwards, because of the increased number of infections, variants started. So the thing is, I think from May onwards, there is this specific variant called NB variant, and it's spreading all over the world now. Okay, but otherwise there are multiple variants like NB, KP, then LP, LB. So many variants are there.
Now, how effective are the vaccines against these new variants?
Vaccines, see, I cannot say that. See, once you take vaccine, it's not going to. It might stop you from getting infected, or it might not. The only thing is it might reduce the complication that can get because of the infection. Okay, so definitely as a healthcare worker, I advise you to take the vaccine because it is recommended as per the CDC. Okay, so you have to take the vaccine, and it's better that way. I know that it's a little bit controversial topic because some people, they might not like it, and I know few patients who haven't taken COVID vaccine so far. There are people like that. So, but it's always better to be precautious rather than like, getting infected, and then prevention is better than cure always. Yeah.
So, doctor, can you explain about the treatment options of COVID?
So, basically what you can do is, first of all, if you feel like you are having COVID, you have to start wearing mask, or you can go to the nearby pharmacy and get tested for COVID, or you can visit the hospital and see the doctors as well. Okay, but other than that, if you are tested positive for COVID, it starts from isolation onwards. So you have to be isolated. So if you are young, that is less than 18 years of age, then you might not spread the virus too much. So as per the protocol, you can get isolated for 3 days minimum. Okay, after 3 days, if you're symptom free, you can go back to school. But yeah, that's it. If you're adults, if you're more than 18 years old or 18, then 3 to 5 days. Okay, but afterwards, after 5 days, once you go back to your work, make sure to wear a mask for at least a week. That's it. So it says that you might spread the virus up to 10 days. Okay, but it might be longer than that for some people. Okay, it's the common factor is up to 10 days. Okay. So the incubation period for the virus is up to 14 days. Means once you get exposed to the infection, you might get the disease within the first 14 days. Okay, I know there are a lot of numbers, but isolation part 3 to 5 days basically. Okay, and if you're elderly, if you're already having underlying conditions like diabetes, hypertension and all, you need 5 days, or we might give you isolation more than 5 days also. And treatment wise, you can stay at home, you have to be isolated, and you have to drink plenty of water. So plenty of water means your urine should be clear or yellowish, very mild basically. So you have to drink plenty of water, unless there is specific recommendation by the doctors that you are not allowed to drink this much amount. Okay, otherwise make sure to have vitamin C or fruits, eat healthy food, you have to take rest. Okay, you shouldn't be doing a lot of work when you're sick. It goes for even flu also. And if you're staying at home, and if there are windows, then leave it open, let the air get inside, give you some fresh mind. And if there is a door, and that is opening up to the hole, and there are other people who are living with you, it's better to leave it open. Like if it is open, don't turn on the fan, because fan will spread the virus to others as well. So make sure to not turn on the fan if the door is open. Okay, that's it basically. And if you're having too much cough, you can have a tablespoon of honey before you sleep. You can take steam inhalation, and if you have fever, you can take fever relievers. So basically symptomatic treatment.
Okay.
And sometimes you might have severe infection. So in such cases, you might have severe chest pain, or if you feel like you're not yourself, then you have to go to hospital. If you're having breathing difficulty, then also. So in such cases, for example, if you're having severe cough and you're struggling to breathe, what you have to do is don't lie on your back. You have to sit, lean a little bit forward, okay, and keep your hand on the thigh, okay, and try to breathe. If you're breathing also, inhale through your nose and breathe out through your mouth. You know how you blow a candle, right? So like that, you have to keep your mouth and breathe out, okay, and then go to hospital right away. Okay, that's it.
And doctor, are rapid tests still reliable for the new variants?
Rapid test.
Yes.
So yeah, you can still use rapid tests, and yeah, there might be like sometimes it can be negative even if you have COVID. So it might be because of the way you are doing the test, or it could be because of the variants as well. But so far, yeah, it is kind of specific.
Can you now explain about the long COVID?
Long COVID means, see, some individuals who got tested positive for COVID, especially who had like severe infection, okay, who needed ventilator or who were admitted in ICU and all, they might have some symptoms even now also. That is long COVID. So your symptoms might last for months or for years as well. Okay, that is called long COVID. So you might feel like severe tiredness, or you might have breathing difficulty. I've seen so many patients who had severe COVID who ended up with fibrosis. It's a condition that affects the lung. So these are all there, and people are still researching about it. So there is no specifics so far, but yeah, it's there. So if you're not feeling better, you have to go to hospital. Don't think that, okay, it's because of long COVID and stay at home, because there are some condition with the same presentation as well. So in such cases, you have to go to hospital and check it out.
So doctor, is it very common now?
It is very common, and I'm sure that this talk is going on around everywhere, because even my patients are saying that, okay, nowadays COVID cases are increasing. It's increasing everywhere. It's everywhere around the world. It's going on, and I think the surge happened during May. So a lot of travelers are there. Definitely it will be there. See, I don't think you have to worry about it so far, because the new variant is not a variant of concern so far. Okay, variant of concerns, you will see a Latin letter next to it. Okay, but so far it's not of concern. So don't worry about it, but make sure to wear mask and keep the protocol, so that way you can limit the spread of virus.
Doctor, finally, what is your advice for our viewers regarding COVID?
Advice. See, I feel like even now also, see, we are getting a lot of patients who are tested positive for COVID. Whenever I explain to them, they are still scared about it. They're not, I don't think, yeah, obviously, like older people, they might be worried about it, but youngsters and all, they are worried about the term COVID. Okay, that social stigma is there that, okay, that okay, advice. See, I feel like even now also, see, we are getting a lot of patients who are tested positive for COVID. Whenever I explain to them, they are still scared about it. They're not, I don't think, yeah, obviously, like older people, they might be worried about it, but youngsters and all, they are worried about the term COVID. Okay, that social stigma is there that, okay, that, okay, I'm sure if someone is infected and they turned out to be positive for COVID, they'll be like, from where I got it? Okay, you might have infected me with COVID. So they are trying to blame it on others. So see, you don't have to travel for getting COVID. That is first thing, because it's there, it's everywhere, because just like flu. So it's the virus is there. So you might get it from touching somewhere. It's very less common. It's rare for you to get infected just by touching on fluids, but it is still possible. and it's airborne basically. So if someone is having cough and you're coughing or you're mingling with one person for more than 30 minutes, then also you can get infected with COVID. So it's there in the air. So it's not necessary for you to travel somewhere to get, or you cannot, you don't have to say, okay, I didn't go outside, I was always at home, because people are visiting you, so you can get infected. So don't think that, okay, COVID is something big, and you have to take care of each other.
Yeah.
Be it COVID or any other disease. Even I'm sure that HIV, people say that, okay, they will try to avoid such people. It's not that. They all are humans, everyone. So we have to take care of each other.
So you mean there's nothing to worry about the new?
So far, yeah, it's not a variant of concern. So you have to stick to the protocols, do isolation, wear mask. So some people, they might not do the test. So even when we advise them to do the test, they might not agree. So in such cases, what you have to do is, if you have flu-like symptoms, if you have fever, then make sure to wear mask whenever you are being with strangers, whenever you are with others in the family also. I mean, stick to the protocols. That's it. That way you can limit the spread of virus. Because even now also Eid is coming, so people will be gathering at home.
Yes.
So you have to be extra careful. If you are having any infection or any symptoms, wear mask. That's it.
And before we wind up, Doctor, what do you have to say about Al Hilal Healthcare?
So Al Hilal is one of the leading healthcare group in the kingdom, and we are having almost 9 branches so far. I know the kingdom is tiny, but we are like branching out. So yeah, it's one of the best healthcare workers in the kingdom, and we are offering best services for affordable price. That is the best thing of Al Hilal. But otherwise, I love my hospital. I'm from Salmabad branch, and all the doctors, they are very sweet and hardworking. Yeah, I'm happy to be part of it, to be honest.
Thank you, Doctor.
Yes.
Thank you
Thank
very
you
much.
so much.
So, viewers, I hope Doctor has cleared all your doubts regarding COVID. If you have any of the symptoms, take care of yourself, go for medical intervention on time, and be happy and be healthy. Till we meet again next time, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.